Hello everyone, so welcome back to my channel. I thought that since I have seen a patient of ankylosing spondylitis today, so let us just discuss this condition. A disease condition which really limits the patients and make them disabled eventually. Now, this ankylosing spondylitis is actually a part of spondyloarthrosis. So, this basically is a group of disorders which include the following. First is, of course, ankylosing spondylitis. Then comes Rhetta's disease. Then come juvenile rheumatoid arthritis. Then comes psoriatic arthritis. Then come arthritis in inflammatory bowel disease. So all five of them are actually part of spondyloarthrosis. Now we'll first discuss features which are common to all five of them, and then we will talk about individually on ankylosing spondylitis. Now all of these are sero negative conditions. All of these will have HLA-B27 positive. And then the earliest and most common joint which we can see affected is SI joint, sacroiliac joint. The most common symptom that the patients comes us with is low backache. And then enthesopathy. What do we mean by that? That there is a painful point of attachment of tendon to bone. So patient can pinpoint that area which is very painful. All of these can have an associated condition called anterior uveitis, and then they can also present with aortic regurgitation, especially in ankylosing spondylitis. So these are some common features which you can see. Now let's talk about individually about ankylosing spondylitis. Now the patients presenting to you will usually be middle-aged males, and the symptoms that they will come to you will be, obviously the commonest symptom will be low backache. They will also present with calcification of intervertebral ligaments, okay, which will eventually reduce their spinal motility. So bending the back will be very difficult for them. How do we check that? We can check by a test called Schober test. If we advise X-ray spine of these patients, the characteristic bamboo spine will be observed. Eventually, later on, what happens is calcification of costochondral joints. So you can see the rib cage getting calcified, which is really problematic for the patients. They can also land up with lung fibrosis. So it can give rise to restrictive lung diseases, and basically the commonest cause of, the obvious cause of death in these patients is respiratory failure. Now, if we talk of investigations, I told you that the best initial investigation is to go for X-ray SI joint, because that is the commonest and the earliest joint affected. And of course, to confirm, we can go for the MRI. Now let's talk about homeopathy in such cases. Now I'm going to mention some remedies here which may be beneficial to manage the pain of these patients, and by looking at the individual, unique, uncommon presentation, you can advise the best suited remedy. So think of Rustox, Simicifuga, Calicab, Sepia, Natramur, Thuja, Sulfur, and Calmia, Latifolia. I hope this information is good enough for you to understand the cases of ankylosing spondylitis. Thank you so much.